Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the pharmacology of the epinephrine. The epinephrine is also called adrenaline. Epinephrine is a direct acting adrenergic agonist and binds to adrenergic receptor without interacting with presynaptic neuron. Epinephrine and adrenaline are similar, meaning epinephrine something close to the kidney, adrenaline something adjacent to the kidney. So epinephrine is a natural hormone that is released from the adrenal medulla. Adrenal medulla is present inside the adrenal gland and that is over the kidney. It is a natural hormone, catecholamine, and neurotransmitter. Epinephrine is a neurotransmitter. The activated receptor initiates synthesis of second messenger and subsequent intracellular signals. Epinephrine is synthesized from tyrosine in the adrenal medulla from the chromaffin cells of the adrenal medulla. It interacts with both alpha and beta receptors. At low doses, beta effect on the vascular system, vasodilation predominate. At high doses, alpha effect, that is vasoconstriction, are the strongest. Actions of epinephrine. It is a sympathomimetic drug. Just we can remember when the sympathetic nervous system is stimulated, we have two ways, either fight or flight. So when we are facing any danger, we have to fight or flight. So what are the changes in our body that happens due to the action of the epinephrine? On the cardiovascular system, increases the force and rate of myocardial contraction, positive inotropic and chronotropic action, and that is beta 1 action. So there will be force of contraction of the myocardium as well as the rate of contraction of the heart. So there will be increased cardiac output. It constricts the arteriole in the skin, mucous membrane, and viscera. There is alpha effect. Dilates vessel in the liver and skeletal muscle. This is a situation happens in case of emergency, in case of sympathetic activity. Increased peripheral resistance, decreases blood flow to the kidney, and increases the systolic blood pressure and a slight decrease in diastolic blood pressure. The epinephrine inhibits the release of contents of mast cell. We know that mast cell has heparin, histamine, serotonin, and the slow reacting substance of anaphylaxis, platelet activating factors. Multiple factors are present, or chemical mediators for inflammation, allergy, or anaphylactic reaction are present inside the mast cell, and these are inhibited. Its release is inhibited by the epinephrine. What are the actions on respiratory system? It is a powerful bronchodilator by beta 2 action, useful to manage allergic bronchoconstriction, asthma, and anaphylactic shock. Epinephrine is a lifesaver, especially in anaphylactic shock. Action on metabolic system. Epinephrine causes hyperglycemia through glycogenolysis in the liver, beta 2 effect, increased release of glucagon, there is beta 2 effect, and decrease the release of insulin alpha-2 effect. Epinephrine initiates lipolysis, breakdown of lipid as a beta agonist, increases cyclic AMP. Cyclic AMP stimulates lipase, that is enzyme, that break down the lipid, which hydrolyzes triacylglycerol to free fatty acid and glycerol. Okay, so what is the biotransformation mechanism in epinephrine? Epinephrine is metabolized by two enzymes. One is MAO. MAO means monoamine oxidase inhibitor, and COMT, catecholin O-methyl transferase. The final metabolites in the urines are metanephrine and VMA. VMA means vanillin mandelic acid. This will be very high in case of certain diseases with the adrenal medulla. Okay, so we may get excessive metanephrine and vinyl mandelic acid in case of tumor of the adrenal medulla. Okay, so pharmacokinetics, epinephrine has a rapid action with short duration. It could be used intravenously, subcutaneously, or endotracheal tube by inhalation or topically, especially on the eye, maybe on the teeth. Some people cannot tolerate the pain of the syringe or needle. So in that condition, even in the teeth management, some dentists use the the topical anesthetic. In the eye, it is very often used as a topical anesthesia. Okay, so we got oral administration is not effective. It will not work because it will be inactivated by intestinal enzyme. So we got biotransformation. In the urine, we'll get metanephrine and vanillin mandelic acid. And this will also present in some type of tumor in the adrenal medulla. We call it pheochromocytoma. Okay. In pheochromocytoma, we will have high level of metanephrine and VMA, that is vanillin mandelic acid. Okay. So we got that. We got the biotransformation and pharmacokinetics. It can be used intravenously, subcutaneously, by endotracheal tube, by inhalation, topically. Idea is that we must provide the fluid in the body, then we can use the epinephrine. If the cardiac output is very low, epinephrine may not work, may be counterproductive. So the body volume should be adequate before the action of the epinephrine, before the administration of the epinephrine. Oral administration is not effective. We have just discussed that part. Therapeutic uses, many therapeutic uses as a bronchodilator as in asthma, there is bronchial asthma, allergic reaction, or anaphylactic shock. Advanced cardiac life support, we need epinephrine. Management of open angle glaucoma, it actually decreases the amount of aqueous humor, decreases the ciliary body vessels diameter. It is a vasoconstrictor of the ciliary body muscle, body vessels. Okay, and it decreases secretion from the ciliary body. So aqueous humor is decreased in amount. So there will be decrease in intraocular pressure. There is a way of management of open angle glaucoma. As a local anesthetic with vasoconstriction action. So it is a local anesthetic. It also a vasoconstrictor. So it also constrict the blood vessels at the periphery. So there will be stoppage of bleeding that may happen at least partially. Okay. Adverse effects: CNS trouble, anxiety, fever, tension, headache, tremor. Hemorrhage. Hemorrhagic adverse effect may cause intracerebral hemorrhage due to high blood pressure. Okay. Cardiac adverse effect: tachycardia and arrhythmia. Lung epinephrine may induce pulmonary edema. There may be electrolyte imbalance, especially the potassium imbalance. There is a possibility with epinephrine. So epinephrine has interaction, especially with digitalis. It triggers cardiac arrhythmia if the patient is receiving digitalis. Epinephrine may induce thyrotoxicosis in patients with hyperthyroidism. There is the cardiovascular system is overstimulated. CVS means cardiovascular system is overstimulated because of excessive development of adrenergic receptor in the vasculature of hyperthyroid patient. So they will have high blood pressure, tachycardia. Epinephrine triggers cardiovascular action in the presence of cocaine. Cocaine is a substance of abuse. So it triggers the cardiovascular action in the presence of cocaine in the body. Cocaine prevents reuptake of epinephrine into the adrenergic neuron, and the epinephrine stays longer in the catecholamine receptor site. Okay. And that's all about the pharmacology of the adrenaline or epinephrine. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.